Have you ever hurt yourself or had someone be hurt while you were at home and not be able to get to a hospital right away? Today, I'm going to teach you how to properly care for a wound in 4 easy steps. I'm Christy Tomajewicz, and those 4 easy steps are: stop the bleeding, clean the wound, protect the wound, and let the wound heal. This will help with an accidental wound, a surgical wound. It'll also help with the skin broken down wound. This will be beneficial to your everyday life by having you prepared for taking care of any type of wound that may happen or you may encounter. It'll also teach you to keep it clean until you can reach emergency services. Today, the items that we will be using is antibacterial soap, triple antibiotic ointment, cotton swabs, gauze of different sizes, bandage to wrap the gauze in place and hold them, and then you'll have an outside bandage to seal them. You will also need scissors and medical tape. If it is not your blood, please use gloves, especially if it is someone who is a stranger and you don't know them. So, the first step is we're going to stop the bleeding. You're going to apply pressure to the wound, have the person hold it above heart, and you're going to do that for however long it takes to stop the bleeding. Then you're going to clean the wound with water, antibacterial soap, and you want to make sure to thoroughly clean the wound. You want to pat the wound dry. You don't want to slam down on it because it's going to be tender and it's going to be sore. Now you're going to pick your size of gauze. If you don't have the correct size, because of course they come in multi-sizes, you can cut the big one down to fit. I'm going to use the small one today. You want to tear them open. Remember that a gauze is sterile, and the moment that you touch it, it becomes unsterile. So you want to make sure that you keep it on that package. You're going to open your triple antibiotic ointment. Depending on the size of your wound is the amount that you'll use. You'll use the swab to rub the triple antibiotic ointment in. You're going to place the gauze on the wound, opening your packaging of your bandage here. And this is just to hold your gauze in place till you get wherever you're going. And it doesn't have to be that you wrap the whole hand. You can leave the fingers accessed enough, but you want to make sure that you put enough layers on it that if it is oozing or bleeding, it will not continue to ooze and bleed through the bandage. Use your scissors to cut. Ask for an extra set of hands if you need them. Now this tape is not your most friendliest tape, as it is a fabric and it's laying on another fabric, so you have to kind of find the edge. I should have done this before. But once you get to where you can pull it up enough to get to that blue line, you just cut across it because that keeps it sterile. And you don't want to wrap the whole thing in tape because that's going to be uncomfortable to the person with the wound. So you're going to place a piece of tape in place. You're going to grab your bandage here. Depending on how severe the wound is, you may need this. You may not. We're going to say that his wound is severe, and we're going to come up through his hand here, back down around his wrist, and you want to wrap mostly around the wrist, as that is where your support and bend is going to be. And you always want to put the clips on top. Sorry. Like this. The wound is bandaged, and he is able now to make it to a doctor for correct, proper care. What's beneficial about this is you can stop bleeding in a matter of emergencies. You can bandage a knee. It'll also keep you from being panicked when the wound happens. If you panic, that is when things become the worst.